Howard Dean was at a healthcare town hall in Reston, Virginia, with Representative James Moran. After opening remarks by both of them, they did a Q&A with the audience.
Tolliver, it's spelled T-A-L-I-A-F-E-R-R-O, but it's normally pronounced Tolliver. Sir? Yeah, there's a microphone right there.
No, I understand what's on the card. It's a similar question that everyone else was asked. And you have exactly. Well, he wouldn't have called my name. I have rather unusual name, so unless they're
Is it pronounced Tolliver?
It is here in Virginia.
Yeah. I'll pronounce it any way you want.
Well, it's one of those things. It's quite simple. Knowing full well that somehow both the Congress and the executive, as well as the other branches of government, will find ways to get themselves off of this particular government-run plan. The question, and I know, okay, you're all those do's and ahs, but the question is, if it's so good for all of us, can't you be on it with us?
I don't know what you're talking about. Since there have been a lot of people that have asked this, let me try to address it once more. Okay? I'm going to try to address it, and thank you for your question, sir. 85% of people, approximately, are not going to see any change in their health insurance coverage. Now, the reason for that is that most plans have adequate coverage, particularly in Northern Virginia. Now, I have a private insurance coverage. It's under Blue Cross Blue Shield. I pay the highest option for my family coverage. And I pay, I think that's about $500 a month approximately. I should have checked before I left. About $6,000 a year. And the federal government matches it at 72%. It's the same that applies to all several million federal employees in any agency of the federal government. If you are a federal employee, you get federal employees' health benefits, and that's the plan that members of, at least I have, and I think almost all members of Congress do as well. It falls under the same plan as the executive branch has. I don't know what the judicial The next question is from Maureen Mitchell of Reston. Maureen Mitchell. Jessica has the microphone in.
Next to your question, but it's about the public plan, which I'm in favor of. Could you explain how we could insure almost everyone without the public plan? Is there a way to insure everyone without the public plan?
There are two countries, sort of two and a half, so I'll leave the half alone, which is Germany. There are two countries, the Netherlands and Switzerland, that actually have universal health care plan without a public plan. But in order to do that, they treat the insurance industry as a regulated utility. They tell them what they can charge, how much they can earn, and what their CEO salaries are. So I have to say, well, the hoo-ha about the public plan, I've long been tempted to ask Congress to put in the Swiss system and see how fast the insurance industry would embrace the public option instead of turning into a public utility.
It's nice to have someone so knowledgeable. Next one, too, Gail. Next is Jeff Verhoff, V-E-R-H. Oh, Verhoff, V-E-R-H-O-F-F. And we'll hear from Roland Tolino. Chestnut Grove Square. Nolan Tolino, but first, Jeff Verhoff.
Here. Congressman, right here. Right here. Over here. Over here. To your left. To your left. Hey, Howard, will you tell me?
Oh, okay, I'm sorry. I didn't, there's a lot of people I just couldn't sense.
You should ask your helper. Please answer this, because you've done the hard questions. You said earlier that Medicare is being run by experts. Who are these people? This is a program that is $39 trillion in the red. These are experts. Who are these experts? Helen from Howard. Helen from Howard. I asked you to answer. Congressman, you're my congressman. How would you answer my congressman?
Let's have a vote. All those in favor of getting rid of Medicare, raise your hand. All those in favor of getting rid of Medicare, all those in favor of getting rid of Medicare, raise their hand. Thank you. First of all, Medicare is not actually in the red because we don't use general funds. Now it is true that we are eventually going to run out of money sooner than Social Security because the cost of medical care is going up. But I don't know anyone over the age of 65 who wants to give up their Medicare, and the reality is that Medicare costs have gone up at a much slower rate than private insurance company costs, and Medicare uses 3% of the trust fund money for administrative costs, whereas in the private system, it's about 30%. So Medicare is operating at a much less cost, and we need to figure out a way to pay for it in the long run, and this is one of the ways that we intend to do that. The experts,
That's what he asked you.
there are federal employees who have spent their much, if not all, of their adult lives running Medicare. And the fact is, they do a very good job. They're located in Baltimore, Maryland, and I'm proud that they work for the federal government.